So one of the big misconceptions around EDS or Ehlers-Danlos syndrome is that you have to dislocate your joints in order to have the condition, and if you don't dislocate your joints, you shouldn't have joint pain. Absolutely factually incorrect. That's not how it works. Regardless of whether someone dislocates or doesn't dislocate their joint with Ehlers-Danlos syndrome, there's many reasons as to why your joints hurt. One of those being that you can suffer microtraumas in your joints. So with EDS, you can get very frequent dislocations, which is where a joint is fully out of its socket, subluxations, which is where it's partially out of its socket, and your joints can be hypermobile. Bear in mind, the older you get, the stiffer your joints get. Important note. Every time these things happen or you hyperextend a joint, you're actually inflicting microtrauma to the soft tissues, so the ligaments, the muscles, and the surrounding structures of your joint. And because you have Ehlers-Danlos syndrome, those microtraumas don't have enough time to recover before the next injury occurs. Your skeleton's not supposed to bend certain ways. With EDS, it bends all the ways it shouldn't. And because of your EDS, you don't heal properly. So you're stuck in a repetitive cycle of getting microtrauma in a joint, which can lead to scarring and inflammation, and as we know, scarring and inflammation can hurt. Subsequently, even if you don't dislocate your joints, they hurt because they bend ways they shouldn't. So next time someone tells you, well, you can't have EDS because you don't dislocate your joints, or you haven't dislocated a joint, so why is it painful? You now know, actually, most likely situation is I've got microtrauma in my joint and the scar tissue which hurts and inflammation. And no, cracking your knuckles doesn't give you arthritic joints, it's just release of air from a synovial joint. Hyperextending your joints, dislocating and subluxing and having permanent injury to those joints can lead to arthritic joints. That's why people with EDS do often have replacements of joints much earlier in life. So if you don't feel validated because your joints don't dislocate but they hurt, this is one of the reasons why. There's many different reasons, and if you're concerned, please go and see your doctor. Microtraumas mean it's inflammation. That hurts. You're valid.